In 1995, some friends of mine and family members formed a nonprofit association for three purposes: to have abundant lives, to be happy, to help others have the same experiences. We base these purposes on five principles: love, peace, truth, tolerance, and cooperation. We named the organization the Order of Love, Peace, Truth, Tolerance, and Cooperation. When I filed the documents with the Secretary of State, they laughed at me. So maybe I thought we should have a shorter name. But we wanted to be reminded of our principles and what we had intended to do. However, we thought a shorter name would be easier to use and to explain our goals to others with more clarity. So we assumed the name Tomorrow's Bread Today, or TBT, and we were able to get a website called tbt.org. It's one of the few three-letter websites on the internet. And we wanted to call attention to the Messianic banquet. So we've used an alternative translation of the Lord's Prayer: "Our bread for tomorrow, give us today." Krister Stendhal has given us a better understanding of this expression in his introduction to the scrolls and to the New Testament. By the celebration of the meal, Christ is proclaimed until his coming again. The prayer, Maranatha, our Lord come, belongs to the Eucharistic liturgy. At this point, it's rather tempting to raise the old question about the meaning of the Greek word epiousios behind our translation of the Lord's Prayer: "Our daily bread give us today." The apocryphal gospel to the Hebrews says, "Our bread for tomorrow give us today." And this meaning is more in accordance with the precise meaning of the Greek word and may be supported by the only instance in secular Greek where it's found: the ration allotted for the next day. Furthermore, the context of the Lord's Prayer is strongly eschatological, about the end things. It's basically a prayer about the coming of the kingdom, the relief from the trial of the ultimate catastrophe, the deliverance from evil. Thus, we hope we've assumed a name that's rich in meaning. TBT is the association that sponsors patient-doctor medical plans. Our local organizers can build patient-doctor medical plans. And the reason to do it is to correct the unnecessarily high cost of care in the United States. Here, the average cost is double what's paid in other industrialized countries. In 2017, in the United States, it was $10,224 per person per year. Now, this has increased to $12,000 in the last 3 years. Switzerland pays $8,000, Germany $5,700, Sweden $5,500, Belgium $4,700, Japan $4,700, Australia $4,500, and the United Kingdom $4,200. But it's not just cost that concerns us. The quality of care here is lower than all the other countries mentioned. Now, a measure of quality is the number of deaths that are caused each year by the people who practice medicine. Here are some examples of death caused by medical interventions. That came from a report published 15 years ago, but has been updated every year since. They said adverse drug reactions were 106,000, medical errors 98,000, bed sores 115,000, infections 88,000, malnutrition 188,000, outpatient things 199,000, unnecessary procedures 37,000, and surgery-related procedures 32,000. Now, the total is 783,000 per year, which is more people than have been killed in all of our wars combined in a very short period of time. Now, this source was printed in a book called Death by Medicine. It was peer-reviewed, and it's been updated. Now, what's life's alternative to death and to bad health care? Well, make an alliance with your friends and neighbors to get health care. Separate the money motive from the care. Create a patient-doctor medical plan. Learn the causes and cures for sicknesses, accidents, and bad financing. Agree on prices and payments with chosen medical advisors. And put the insurance companies and the government in the back seat and take them to where they need to be. So how do we begin? Well, start a conversation with someone who may share your passion for health and happiness, and create a patient-doctor medical plan in a short time, as short a time as possible. Well, who are we to say this? Well, we're a nonprofit association of patients and doctors. We're a discount medical plan organization. We're a healthcare administrator. We're a general agency. We're an approved association empowered by group insurance. We're a medical services organization representing medical practices. We're a developer of local chapters of patient-doctor medical plans. What can we do together? Create a patient-owned, universal healthcare system. Get healthcare that patients want and need. Reduce the cost of care by 30 to 50% of the amount paid in the US now. Eliminate deductibles and coinsurance. Help patients deal with access to and pricing of healthcare. What ways can be used to create a local chapter of the patient-doctor medical plan? Well, one way would be to hire 5 community organizers who talk with new people each day to set up communication lines and build relationships and find common interests. Then ask the people with whom communication has been established to invite others into the conversation. Enroll through a free limited offer to 1,500 people to create a local patient-doctor medical plan chapter. Stay in touch with those who want to have health care and want to talk about how to get it. In a short time, 6 to 8 weeks, about 2,500 people will have been conversed about a local patient-doctor medical plan. Now, a chapter that large can afford complete health care for every member. That size group is equal to any large employer group in bargaining power. What are the barriers? Well, there are no legal or administrative barriers. There are no lack of available medical care providers. There's no reason not to accept insurance plans that will bargain with you and give you good prices. But the local chapter must be defined geographically so people are close together, can know each other. Every member must be able to pay their dues and fees. There's no free lunch out there. The cost is much less than people are now paying in premiums and out-of-pocket expenses. So the cost of organizing this is using money that you're already wasting. So what do you do now? Complete the medical form for free services. Invite 2 people to your next meeting or conversation. Get ready to change healthcare in America. Learn everything you can about the patient-doctor medical plan, its benefits, and about medicine. Now, the standard benefits most often adopted by a group for primary medical care, assistance of a personal patient advocate, diagnostic lab services, diagnostic imaging such as X-ray, CT, MRI, PET scans, ultrasound, mammographies, and specialist services such as cardiology, gastroenterology, podiatry, pulmonology, ophthalmology, general surgery, orthopedic surgery, urology. Telemedicine is important. You can have that 24 hours a day, 7 days a week, 365 days a year. The health club is important. We give rebates to help people join health clubs. Association group indemnity insurance to cover hospitalization for the first $50,000. Association catastrophic group stop loss insurance from $50,000 to $5 million. Roadside assistance, discounts on dental, vision, DMA, prescription drugs, and specialty providers who may not be in direct contract with you. These comprehensive benefits are 30 to 50% less expensive than traditional group health insurance. Now, these are the plan options. These are not insurance. These are ways to pay for health care. Basic membership in the patient doctor medical plan includes access to the provider network at fair prices. Doc Welby's dental discount plan, affordable health care is vision, hearing, and roadside assistance, teledocs, telemedicine services, and a prescription drug discount card. Now, this is free for 6 months, but beginning in the 7th month, each family would pay $10 a month. That's the most fundamental membership there is. The second plan would be a concierge plan that included the basic membership above, and patient advocacy from the CARES group, and lab services from clinical pathology laboratories, and primary care with no copayment, and medical imaging with no copayment. And the cost of that package is $115 a month for adults and $80 for children. Then you can add, in a third plan, specialists to the program, to plans 1 and 2. And you have specialists at zero copay. And the cost of that is $200 for an adult and $115 for a child. But it includes a $20 rebate for health club membership if you join one. Now, the group indemnity policy is $1,000 to $50,000 per episode, and the association stop loss is 90% coverage from $50,000 to $5 million per year per person. Now, employer group plans use association health plans to lower their cost and bring protection against unexpected high cost of hospital and surgical expenses. The employer and employer cost of a patient doctor medical plan, membership, and group insurance cost each adult $414 and each child $200. Usually, employers pay at least 50% of the cost, and the plans include the patient doctor medical plan membership, Plan 3, and the group indemnity and stop loss insurance, and payroll services, and plan terms that make it compliant with the Accountable Care Act.